And now I'd like to introduce you Dr. Labschies from Med Plast di Berlino. He's our keynote speaker, and he's a pioneer and specialist for lipedema.
I have a presentation. Yeah. Yeah, that's okay. Yeah. Thank you so much, and it's a pleasure to be here. Dr. Weyer and me, we are together as a team here. So the name Med Plast is like a company. We are now 7 plastic surgeons international, and we have some experience with lipedema surgery. We just do lipedema surgery, and think that in the times we are not sure where does it come from and where does it lead to. But all the experience we have, it's so important to have congresses like this today, where we can speak to each other, where we can take the chance to exchange information. And after those 2 videos, my head is full of information, and my head is full of terms. I would exchange information with you the whole day, and maybe I will run through my presentation to save some time to get into communication, so that you can ask things that you want to know, and that we save time so that you profit from that. The video from Dr. Amron was really professional, and everything he told from my point of view, those are medical terms, they are all right, and they are individual, and he has his own experience. But the right thing, I think every surgeon is okay with that. It's not about the technique, it's not about the material, it's not about the machines. If you have 100 machines, you are not the best surgeon. You need to be like, you need to have a passion, you need to have experience. And don't ask the doctor, ask the patients. And this is something, this is really important. The video from Maria was excellent. So she spoke out of my heart as a surgeon, because this is not just a logical story to develop, to give you the chance where you get information. This is something that that is really true. Take care when you look for pictures, when you go into the internet, and then you have all the folders from Dr. X and Dr. whatever, yeah? And everybody has his favorite doctor, and you will see very good pictures. So it's sometimes, when I would be a patient, I would never show the world something I'm not okay with. Yeah, I always see pictures in a stretch situation. When I stretch when I stretch my leg, yeah, I see more wrinkles on my surface than when I do it in an ankle position. And so sometimes it's not so totally clear to distinguish. Yeah, and it must be clear that everybody is individual. If you suffer from lipedema, and you look for a doctor, looking for information, a surgeon, yeah, you need somebody to find who is able, because of the experience, to tell you in your individual situation what the surgical therapy can lead to. And just one thing, nobody knows where the regrowth comes from. The regrowth is from our style of thinking, an hormonal change, sometimes caused by the surgery. The surgery takes a lot of hormonal active tissue away, and this change in the rest of the body can lead, however it works, nobody knows, can lead to a regrowth on other parts of the body. As a patient, you need to be aware of this risk that can happen. You need to be aware of what it means if you start a program of lipedema surgery, which not is one surgery at all, and then you're cured. It's a big decision, and it's a big effort, and you need to know if you start it, you have to go through it. And at the end, nobody can promise you where does it lead to. The doctor doesn't take the responsibility for the genetic, and doesn't help you by the way aftercare, what the natural is doing out of this individual result of surgery. But the surgeon must be sure that he is able to plan your surgery in a safe way, to perform it in a safe way, to have the skills and the willing to get the best results individual for your situation, and then to check himself or herself in the aftercare if this is the right way. Today we're in a situation where we feel that we are on the right way. We have some experience, and the people I control, I operated many years before, are not that good from the results than those I operated like 2 or 1 year before. And this is the style we operated. And this is not my speech here, it's like an overview of Lipedema Surgery in Germany. Let's run through it to save the time here to answer some questions. I think this is the most effective you can profit from. Lipedema surgery, where does it come from? The principle is the liposuction, of course. And the principle of liposuction began 90 years before. There was in France, there was Ducharier, it's a physician in France, who made incision at the skin, and with a sharp blade, he went under the skin and scratched the tissue out. That was not a good idea, there was a lot of bleeding. The German guy, Schröder, many years later, 1977, imagine. So liposuction isn't that old. He had another idea. The word is exerese. He went under the skin like with a blade and grabbed it and also like pushed it out. Here in Rome, you had a really tough guy. His name is Giorgio Fischer. Giorgio Fischer, he created a machine. Also went under the skin with some bladders like a machine, cutting out the fat. No good idea. So it was all not successful till in the United States, Mr. Klein, everybody knows Klein, the Klein's technique of tumescence, like swelling and then doing the lipo. And that was the revolution. That was in 1987. And so in America, they founded the Association for Liposuction. And when I was 15 years old, I was a young man. And in my neighborhood, there was a surgeon who was actually a dermatologist. And Rosenpark Klinik Darmstadt, Dr. Sattler. And I was impressed, like there was a lot of traffic, and I could see there were international patients. What happened? He was the first one using the tumescent technique, doing a lot of liposuction. And with the time, the dermatologists in Germany, they grabbed the liposuction, they had more experience, they did it with a higher experience, and then they started their research. And nowadays, the research we have, they come from the dermatologists, and not from us, not from the plastic surgeons, who think we are the only ones who are able to treat it because we are the only ones who have it in the program to learn it. It's not a style of thinking. You need a doctor who has the experience with it. Doesn't matter what is the specialty. Okay, when I went to university, I never heard the word lipedema. It doesn't exist, and nowadays it still doesn't exist. It's not there. And when I specialized in plastic surgery, I heard, like those are the fat ones, not the, and I was shocked, like nobody knows what's going on with that term. And then I remembered that the guy, in my childhood, and I did my research. I knocked on the door, and I knocked on the other door, and I knocked on the third door, and I recognized that we don't know really about the lipedema. And till today, we really don't know. It's just the experience we have, and let's talk about that. So nowadays, can you put we are able to do big volume surgeries, and when you do liposuction in the lipedema style, you need to be able to do the best thing in one operation without bringing the patient in a medical dangerous situation. This is for sure. And sometimes, and this is individual, sometimes we take out 10 liters here, 12 liters there, oh, just 2 liters over there. And when two patients in our clinic are in the same room, and the one has the feeling, oh, what? The doctor took out 13 liters in your operation, in mine just 2. Why did I have to pay the same amount, and what isn't that unfair? It's not about the liters. Really, it's never about the liters. It is about the safety. When a surgeon plans to operate a lipedema, then he plans to operate an anatomical area and reduce it to the right layer, and then you should be safe after this. And you go on with the next step, you go on with the next step, and you need to be able to plan the frequency of the steps so that a patient can imagine what it will be to undergo lipedema surgery. Okay, so it's developed when it came up, lipedema. Everybody is like, oh, this is a new style. Did you hear? It's just a liposuction. Yeah? We do it also. Everybody knew about lipedema. But it's not. Ask the patients, and do your experience with the doctor. In Germany, then, we have the situation that at least it has numbers. It was unknown, and you know that the World Health Organization is responsible for getting all the diseases in numbers. And here's a working group in Rome that is good. They work that, on the new numbers in the WHO, that the lipedema in the next catalog, it's the ICD, International Cluster of Diseases, will be in the catalog to spread it worldwide as a known disease and not just as a condition. In Germany, we have it as a condition or as a disease. It has a number at least. And this is the institute giving those numbers. Next, please. And we have the guideline. Don't misunderstand the guideline. The guideline is just something that gives you an idea as a surgeon. The guideline comes from the dermatologists, I told you. The dermatologists made the experience. And when you read names in Germany, where all the scientific things of lipedema started, you hear all day long the same names. You heard from colleague Amron, the Dr. Stutz. You hear Dr. Corneli, you hear the Dr. Labrich, you hear the Dr. Schmeller. And those guys are dermatologists. And they put their experience in the guideline. And this guideline is nothing like a rule or a standard. S1 in Germany means standard 1, which is really a low standard. Low standard means you can do it, but it is not clear that this is scientifically the best way. So there are some surgeons, they tell you, like, I do it in the lip-sparing way, and I do it as the standard says, and I do it like this, and I do 10% of it. So when you put it all together, this is putting something together, but it's not a rule, you know. There, in the lipedema surgery, there doesn't exist a standard or a rule. It is very interesting when I saw then that the highest names in Germany I mentioned are discussing officially in scientific works against each other. If you browse that and you find the myth and the facts of lipedema surgery, this is really great. Yeah, read through it and think about it, and you come to the conclusion nothing is clear. The one professional is telling there doesn't exist an edema. The other one is telling lipedema doesn't exist, it only comes from adipositas. Like things or messages, you think like, why is that? If those guys don't know about these basic things, where are we? Huh? Yeah. So, what do we have? We have a gray zone. The gray zone means there's no rule, there is no standard. Everybody can do whatever he does. There's absolutely nothing that gives you the safety. Here I'm right. This is my doctor, this is my way, and this is my future. It is not. Next, please. Our Ministry of Health, this is Mr. Spahn, is very like in a populistic way. He promised this year, okay, we will do lipedema surgery stage 3 for everybody. When? Till next year. Next year, this is January. And January means in 6 weeks. Oh, in 6 weeks. I thought, wow, lipedema surgery paid by the official insurance for everybody. Let's ask by the insurance companies, how does that work? I called them. I called 3 insurance companies, asking them, look, it's us, the Lipedema surgeons from Berlin. Where do you send your patients in stage 3 on January? No answer. There's no regulation, there's no implementation. And we are wondering what will happen next year. And it should be clear for you that the stage 3 patient is a totally other style to the target of the operation style than a stage 1 patient. If the stage 3 patient suffers from pain and one doctor in one hospital with some technique, with some experience, just takes out some litters to improve the situation of this lady suffering from lipedema, it's worth it. And that will be a great story. That will be a big step in Germany if next year stage 3 will be covered by the insurance. But don't misunderstand, the result, like has nothing to do with the lipedema surgery, like Dr. Amram showed you in the video. Yeah, if you do it in the stage 1 or stage 2. Yeah. So this is where we stay today, and I'm happy to give the microphone to my colleague there, Dr. Wyatt, who will go on in the Italian language, so you profit from that. But I would be happy to answer your question because I think there are a lot of those. Thank you so much.